ahead of World Health Day, which we celebrate.
Tomorrow is World Health Day. COVID-19 has exacerbated inequalities both between and within countries. While we have all undoubtedly been impacted by the pandemic, the poorest and most marginalized have been hit hardest, both in terms of lives and livelihoods lost.
Very special guests online with us today.
This week will mark the 100th day, and 190 countries and economies have now started vaccination. COVAX itself has already delivered 36 million doses to 86 countries and economies. Supply chains are up and running and health systems primed. Scaling up production and equitable distribution remains the major barrier to ending the acute stage of this pandemic. It is a travesty that in some countries, health workers and those at risk groups remain completely unvaccinated.
Excellency President Carlos Andrés Alvarado Quesada from
Equitably sharing of rapid tests, therapeutics, oxygen, and vaccines are key to ending the acute phase of the pandemic. That means tech transfer, sharing know-how, and waiving intellectual property rights.
For the last question, we go to Robin Mia from AFP.
Vaccination is one element of the response strategy. And as Mariangela has said, as you have heard us say repeatedly over and over again, we are accused often of being a broken record, and we will be happy to continue to be this broken record until this pandemic is over. But there are a number of elements, interventions that can be used that drive down transmission. Globally, we have passed the 6th week in a row where we have seen a consecutive increase in cases around the world. Last week, there were 4 million new cases reported to WHO, and that is likely an underestimate of the true infections that have been occurring globally.
And Hungary have seen some of the highest rates in the world.
So we cannot rely all on vaccines and vaccinations. We have to continue to put in the individual level measures. We need communities that are supported. If there is a stay-at-home measure in place, we need governments to support individuals to be at home. All of this still matters. So we will continue to be this broken record and remind the world that there is a strategy out there about suppressing transmission.
Suggest that there may well be.
What we can say is that the appraisal that we have for the moment, and this is under consideration by the experts, is that the benefit-risk assessment for the vaccine is still largely positive. We continue to see a number of events that are rare events linking thrombocytopenia to thrombolytic events, and those rare events are now being categorized in terms of the diagnostics, in terms of the population, in terms of the distribution within the population, and the expert committees will come to decisions in coming hours and coming days about what will be the regulatory status for the vaccine.